Upper cervical care can actually help anyone with a nerve system. Nerve system controls your health, nerve system controls function. So whether you're an infant or whether you're grandma and grandpa, or maybe somebody with a condition already present, or that person who is a top athlete who wants to perform better, upper cervical care can really help anyone perform and be at their best.
I've had patients from their first day being born and they had a subluxation, which means that that body was out of alignment, putting pressure from the brain, trying to communicate down, and that baby did need a correction at that time, even though the baby was day one.
The youngest patient I've ever adjusted was 3 hours old. My oldest was 94 years old. It's just awesome working with kids because they respond so quickly. And it's so great to be able to work with a child and know that they're not going to have to suffer the things that other people have suffered throughout their life. To take care of the cause of that problem before it ever happens.
Some people feel that children or infants can't go out of adjustment. And I find about 50% of the kids I check are locked out of alignment. And interestingly enough, we find constipation, we find colicky problems, we find ear infection problems, and all sorts of problems that kids can have. What concerns me is if that child falls and hits its head on the fireplace hearth, or hits its head on the coffee table, something's got to give. And just because you don't see any blood doesn't mean damage didn't happen. And oftentimes you'll find you've got this kid that you're calling it the terrible twos, and it might very well be the terrible atlas that's giving them trouble.
Getting a child checked following birth is one of the most critical times to check a child because the functioning of the brainstem is critical to their development.
All I've ever seen are miracles. Children, older people, with all sorts of afflictions.
Within just a couple of weeks, the pain was gone and never came back. That was 4 years ago. Now, she still comes to see me after her soccer tournaments to get checked because she knows at 15 that when her spine is out of alignment, she's not doing as well. She doesn't play as well. She doesn't feel as good. I love my high school athletes. They are so much fun.
If you could imagine if she would have had the opportunity as a child to have gotten checked, to have had her nervous system checked as a child, before her first symptoms of asthma ever even arrived, before she had hypertension or diabetes, before all those things occurred, if she would have had her nervous system checked, I'm very confident that her whole entire life, the past 20 years, would have been dramatically different. Her potential as a human being and her quality of life would have been very, very different. And so it's exciting to be able to educate people about that so children can have the opportunity and more people can know about it so they can live as healthy a life as possible and not have to be faced with huge obstacles down the road because the nervous system wasn't functioning right for over 20 years.
The mother who brings her son in, 2 months old, screams for 2 hours every night because he has colic. That child is experiencing pain, but also the parents are experiencing pain. It's the anguish of, there's nothing I can do. And they tried everything. And then after the child is adjusted, he sleeps like a baby. That's what I love to see. So every day I touch people and they feel better. It's so cool. It is.